Good afternoon, everyone, and welcome to the session on system changes in healthcare. My name is Katrina Papalier, and I am honored to serve as your moderator today. I have been a community health nurse for over 25 years, serving in the maternal child health community here in Arizona for all families. I currently serve on the boards, including the Arizona ACEs Consortium, ADHS Maternal Mortality Review Committee, the Fourth Trimester Ecosystem Board, and the ASU CIRC CAB. I'm passionate about increasing health access and education for families and children across our state. So this session today will focus on how we can think more deeply about the complex social problems that often seem intractable and the systems that keep them in place. Our partner and gold level sponsor, Vitalist Health Foundation, is committed to tackling these challenges through innovative systems thinking approaches. Today, we'll explore FSG's 6 conditions of systems change, a framework that helps us better understand the root causes of persistent issues in healthcare and social systems. This interactive workshop will give us all a chance to practice applying a systems lens to the work that we do and to identify how we can incorporate systems change strategies moving forward. Please take a moment to review our disclosures, which can be found on your screen. Now, I am delighted to introduce our speaker, David Martinez III. David Martinez is the Director of Strategic Community Partnerships at Vitalist Health Foundation, where he leads the foundation's capacity building, grant programs, and civic health portfolio. In this role, David builds and stewards key community partner relationships across Arizona. His leadership extends across various civic and health-related initiatives, and he brings a wealth of experience in both public policy and community engagement. Having worked with organizations like St. Mary's Food Bank Alliance, the Center for the Future of Arizona, and as a student regent on the Arizona Board of Regents, David is passionate about fostering community resilience and using systems thinking to address some of Arizona's most pressing challenges. Please join me in welcoming David Martinez to the stage.
Do I just tell our next slide?
Yep.
Oh, okay, cool. Well, welcome everybody. Thanks for having me. Note to self, get a new headshot. That was definitely a pre-pandemic. Oh my goodness. Well, yeah, it's such a joy to be with you all. Congratulations to all the great work that Fourth Trimester and all of the community partners are doing in this really critical space of child and maternal health. I'm glad to be joined here by my colleague, Anna Rossetti, who I'm sure you've heard from earlier today. We're excited to have her on our team and bring her wealth of knowledge and experience to our efforts to improve the health of people and communities throughout our great state of Arizona. I am going to talk about the super wonky, super academic concept of systems change. But before we take a deep dive into how we frame that at Vitalist Health Foundation, I'm going to open up on the next slide with a video that you might have seen before, but if you could hit play on that, we can have a good time. Oh, okay. Use your imaginations, right? Okay. We'll send this as a follow-up or do a YouTube search for I Love Lucy chocolate factory. And oh, right. Okay, Jeremy, you're Lucy. Anna, will you be Ethel? That would be great. Matt, you're the boss, okay? So if you haven't seen, raise a hand. Have you seen this clip? It's so funny. And I did this session yesterday and the day before with the Coconino Coalition for Children and Youth. And it was virtual and we showed this and I was just like dying. And I'm like, I hope other people are having as good of a time as I am on this because it's such a funny clip. But if you haven't seen it, the gist of it is Ethel and Lucy, of course, from the iconic show I Love Lucy, are put in a chocolate factory like conveyor belt to wrap individual chocolates. And the chocolates are coming out of this machine, and they're supposed to wrap them and then put them back on the conveyor belt, and it goes on onto the next step. They are there because they've been fired from every other role in this chocolate factory. And this woman in the middle is their overbearing boss, right? They're like, this is your last chance, right? You got to do this right. If not, you're out of here. You're fired for sure. So the boss comes in, and this still here is her saying, let her rip, when the machine starts to put chocolates through the conveyor belts. And then there's nothing coming out initially. So she's like, let her rip. And that's when the audience laughs, it's kind of funny. She's like, okay, I got to go fix this. So the boss goes to address off camera whatever the issue is with the machine. And then she comes back, she's like, okay, they're awake at the wheel. And she says again, let her rip. And the chocolates start coming out. And it's pretty steady pace, but Lucy and Ethel begin to wrap the chocolates and then put them back in, and everything's going okay. They're getting some confidence. And then the conveyor belt just starts to speed up. And they're just like, oh my goodness. So they're like frantically trying to wrap these chocolates, right? And there's too many going by. So they start to eat them and put them in their outfits, their uniforms, their hats. And it's just hilarity ensues, right? And the boss comes back in, and by the time that they are like stuffing all these chocolates that they couldn't wrap in time, it's the conveyor belt is cleared. So it seems like they're doing a good job. So the boss is just like, wow, you've got it all done. Speed it up, speed up the conveyor belt. And they're like freaking out, no. And then the clip ends. This is my favorite way of explaining what systems change is. Because it has so many different components of what makes this work very challenging. The concept of the initial piece that the machine that is dispersing the chocolates is broken can reflect the actual system that is broken. And then you have an overbearing boss. Anybody work? No, you don't have to raise your hand. You have overbearing people, challenging partners, challenging institutions and systems that are just like down your neck and just making the work even more hard. And they're just like, they're like, let her roll, right? And then in this clip, Lucy actually says like, we're fighting a losing game. And who has ever felt like that, right? You are just like working, doing your great job. You're just fighting a losing game. And then once you start thinking, okay, I got this, things are going good, that overbearing partner or institution comes in and says, speed it up. You're not doing well enough. Anybody ever experienced that? So this clip really exemplifies system change, Grant. So my presentation is done. Thank you so much. If only it was that simple. This work is really, system change work is really hard. It's really taxing. And then you think about the different kinds of systems that need to be changed and that you all are working in, and it makes the work that much more taxing and challenging. So I love to frame system change like this as well, because we need to have some joy in the world. There is good happening. You all are doing such good work. And we have to remember that while all this work is really heavy and taxing, we can bring some joy, spark some joy into this work and laugh. On the next slide, so now we have the joy and the fun. Now let's get into the wonky academic stuff of what is system change. So Vitalist Health Foundation, if you don't know, is a Phoenix-based foundation, but we have partnerships throughout the state of Arizona. We do both programmatic work in healthcare integration that my colleague Anna oversees, the integration between the physical, mental, and social determinants of health. So we see health as more than just healthcare, the broader social determinants of health, or the elements of a healthy community wheel, if you've seen that. We have a portfolio around housing, portfolio around civic health, and then our responsive grant making as a foundation, we do grants as well. It's all focused on supporting coalitions and their system change efforts. And I'll dive into that at the end here. But we have been implementing the systems change concept and supporting systems change for about a decade now. And we've had really great success that I'll highlight in the next series of slides. But we took a kind of a 10-year evaluation, a look back on our past grant partners, and then just the ecosystem here in Arizona, and realized people ask themselves, what the heck is this systems change? We really don't know what it is. And so you're telling us like, oh, go do this systems change work, and you're not really helping us better understand what it is. So as part of that, we are doing the systems change series to better define what we mean by systems change, both to promote our grant partnership opportunities, but because we want more folks in this larger ecosystem to approach their work using a systems change lens. So we have a Spark report, which is kind of our version of a white paper that better defines what we mean by systems change. We've partnered with the group FSG, or For Social Good, that also, you can't see the logo, but Collective Impact Forum. They have a partnership with the Aspen Institute that a lot of folks are familiar with. The collective impact model, a lot of United Ways use as well. So we partnered with FSG to draft this Spark report. On the bottom right-hand corner, that's the FSG president, CEO, John Harper. We hosted him for the keynote speech at the AZ Impact for Good annual conference. We've also done a follow-up series of interviews and chats with him and his team to better define and build a framework around systems change. And then we've used our own communications channels to highlight successful systems change grant partnership opportunities. Are people familiar with Feeding Matters and the great work that Jacqueline Peterson has led? They were they led a very successful coalition to implement a new diagnostic code for pediatric feeding disorder at the federal level, like big, hairy, audacious goal, right? And once they got the diagnostic code, they were able to get the reimbursable code, and now those services are being provided to those families and children impacted by pediatric feeding disorder. Love Jacqueline, love that work, great success. So it's all part of this campaign to help us define what is systems change. On the next slide, though, we'll see that before we get to the systems change piece, we have to understand the system, right? That's what we're trying to change. So what is a system? This is where you start getting into all these wonkish academic words, but a system is a set of interconnected, interdependent, and interacting parts that form a complex unified whole. But make it simply, a system is a set of whole parts working together to form a more complex whole. There are so many components that make up a system. An analogy that I like to use is a bike, right? You have so many different parts, but they all have to work together in order for the bike to work, unless you have user error like me. But you have the pedal, the chain, the gears, the tires, the steering wheel. Those are all interconnected, interdependent, and interacting parts for the bike. A bike is a system, right? On the next slide, we get to delve into what the specific characteristics are. So there is, as part of a system, supposed to be a unified whole whose goals and results emerge from the interaction of all those components. An important concept with systems is that they're not stagnant. They could be living and breathing. Our bodies are systems, right? Our internal bodies. There's a lot going on in here. And our family network, our family is a system. The schools that your children go to are school systems. And then you have greater kind of institutional systems like government, state agencies, right? Our city departments, or hospital systems, healthcare systems. So it's like both macro and micro. A system is non-linear, right? It's like a bowl of spaghetti. And if you've ever worked towards systems change, it is just like that. You're not moving from point A to point B. Before you get to point B, you have to somehow get to point Z. It is like all over the place, constantly evolving, very dynamic. And another big aspect of a system is that it's decentralized. There might be kind of a core center, especially if once you have a focus, and we'll see that in a couple of different slides. But there's a lot of different kind of shared leadership, shared governance characteristics of a system. What does it look like visually? On the next slide, don't be afraid. Does this look familiar to folks? Right? So an illustrative systems map. This is focused on children 0 to 8, right? The core of that system. And then the concept is you have concentric circles. And the further you get from the center, the further the proximity is to that child's lived experience. So you have a child 0 to 8 in the middle. Of course, their parents, family, friends, and neighbors are very close. Their teachers are really close in that concentric circle. But then once you span out, you start to look further out around like their school districts or child support specialists, practitioners, different settings, different support roles and organizations, certainly policy, funding, and governance that impacts that child's ability to live a healthy and productive life. It's messy, right? There are so many different moving pieces to this individual system, and there are efforts to coordinate for children 0 to 8, but sometimes we focus on a particular sector like parents, families, and community, which you see on the left side, or the care and education, the health piece, the social service piece, or other influencers, and that's okay, but it could, again, be small or large. That's the system. On the next slide, we begin to delve into the systems change piece of it. So a systems change is when you actually start to shift those conditions that are holding a problem in place. That's really important because a systems change piece is in the public health sphere, the downstream, upstream kind of messaging, and upstream intervention is tackling the root cause of the problem that is holding the problem in place. That is the systems change, or sometimes the policy systems or environmental change, an upstream approach, as opposed to a downstream approach, which would be a bit more programmatic or addressing the symptoms of the problem rather than the problem themselves. So more simply, systems change involves influencing how the parts of a system interact to alter the system's outcomes. On the next slide, you'll see the wheel that Vitalis uses, the elements of a healthy community. As I mentioned, we see health as more than just health care, broader social determinants of health. Systems exist in each individual spoke of this wheel, but a big message that we convey at Vitalis is that these spokes, like an actual wheel, are all interconnected. They're all intersect with each other. And while individual organizations and sometimes collaboratives focus on a certain element of the wheel, and that's cool, it's all connected, right? And we really want to focus on how that intersection is the middle of this wheel. And of course, very important aspect of this collective impact model is framing this work using a health equity lens and a resiliency effort. As I mentioned, Vitalis partners with this national group called FSG that also is part of what the Aspen Institute, the Collective Impact Forum. On the next slide, if you're familiar with Vitalis, you've seen this inverted pyramid as well. These are the 6 conditions of systems change. So you can begin to think about your total kind of systems change effort in this model. And this is actually the model that we use to help us better define what is systems change and help folks see their work as potential systems change. There are 3 tiers as part of this inverted pyramid, right? The top tier, these are structural change opportunities, policy, practices, and resource flows. These are explicit because they're easy to see, right? When you have a policy change, you see that. You propose new legislation, or you try to get an ordinance passed at the city level. It's a really tangible concept. And once that change happens, it's sort of like a light switch, right? The light turns on, we see the good of that law being changed. Resource flows is another example. It's when you start getting to these lower levels where it becomes more implicit, much more difficult to see, much more difficult to define, but they still are systems change. So relationships and connections, power dynamics, still a little bit more easier to see, and we'll take a deeper dive into each one of these conditions. And then of course the mental models, this is the changing hearts and minds. This is the truly transformative systems change, but really hard to see, because how do you really see that? In our efforts at Vitalist, you don't have to tackle all 6 conditions because that is the truly transformative systems change. You could be just focused on a policy change, or once a policy change, the practice change that needs to come from there. So we have examples of partnerships in each one of these conditions, or in 2 or more. So now let's take a deeper dive into each one of these tiers. So the first tier here, again, the structural change, the most explicit. These are the policies, practices, and resource flows. Policies are folks are pretty familiar with. Practices, these are more of like sort of internal controls, practices that institutions often set up. as a system. Resource flows is a really, really fascinating one, and one that we're seeing a lot more of, especially my colleague Anna, because we want more resources to flow from sustainable sources or sources outside of like private foundation donations or whatnot, like Access, right? And thankfully, Access through their whole person care initiative is really looking at how to expand the resource flow that's coming through Access, including housing and behavioral health in school settings, for instance. So that's structural change, policy practices, resource flows. That middle tier on the next, if you click one more, in just put them all in: relational change, relationships and connections, power dynamics. These are really important and still conditions of systems change because, as I mentioned, systems change work is heavy work. It takes a village. Not one entity or one person can achieve, in some instances, one condition, let alone all 6 conditions of systems change. So you need these relationships and connections, and you need these conditions in place to impact system and systems change. And a systems change is going after the root cause of the problem. Something is keeping that in place. Who has that power? Who can change that? And it could be a person or kind of an agency or organization, but something is holding it in place. Somebody has the power and their thumb, right, on the scale, or somebody has authority or influence. And if you change that condition, we can change systems as well. And then the mental model change, again, changing the hearts and minds. This might seem completely like outlandish, like changing hearts and minds, wow. But there are recent examples where this mental model shift has happened. One great example I give is in the LGBTQ community. I mean, over the past couple decades, we have seen just beliefs and assumptions about the LGBTQ community shift. Certainly along more ways to go in the progress, and there's been some slippage, but that mental model has shifted with people's beliefs and kind of perceptions of the LGBTQ community. At the same time, that has policies have been changed. Remember, don't ask, don't tell, right? Or there's now the freedom to marry, right? So policies have changed, but mental models have been part of that as well. Vitalis has a really cool systems change grant partnership with the group out of Tucson called Boys to Men Tucson, not the band. They're from Philadelphia, right? Boys to Men Tucson, which is a great national network of chapters to tackle this mental model of toxic masculinity. Ooh, really tough, right? One of the policies or some of the policies and practices, though, that they're trying to do is change the way that young men and boys in middle and high schools have an interaction or relationship and connection to older men to see as mentors and of people to look up to. So they are working in the school system to change policies and practices around disciplinary action, especially for boys and young men of color. Instead of sending them to suspending or expelling them, they rather connect them with a trained, skilled, qualified male mentor in a safe setting. So that they're doing that kind of policy and practice change, but also bigger picture, trying to change a mental model. So on the next slide, we're going to run through a case study of what this means. This may not be the case study that everyone is working on, but you see the challenge on the left-hand side, right? So BIPOC students, Black, Indigenous, people of color students do not graduate high school, college, and career ready. That's the challenge, right? That's the problem that's in place. Now, there are kind of challenges that exist in each of the conditions. So you see for policies there, students that don't pass state mandated subject exams are excluded from extracurricular activities and courses. That's a policy that happens at the school level. Or a practice, BIPOC students tend to receive harsher disciplinary action than white peers for the same offenses. This is data that is true. Okay, we know this here in Arizona. We had a systems change grant partner more than a few years ago, the ACLU of Arizona, that worked with school districts to look at this case, and this disciplinary data showed that there was harsher conditions, and they began to examine why that was the case. And as part of that, they had this theory that the school administrators and the school teachers didn't reflect the student population. So out of that effort was born a great organization called All in Education, Arizona Latino Leaders in Education, that is trying to improve Latino representation in the classroom among teachers and administrators. Resource flows, BIPOC students attend underfunded and lower quality schools, right? So now that's a challenge. What's the ambition? On the next slide, you'll see the left box changes to the ambition. We still want students to graduate high school, college, and career ready. So what are some policy changes we can implement? We could integrate more culturally diverse content and assessment materials. We could revise school disciplinary policies to limit out of school time and miss extracurricular activities. That's happening a lot in school districts. You could see the same solutions under practices, trauma-informed training. We have a great partnership with Coconino Coalition for Children and Youth, as I mentioned, that does a lot of this at the city and county level. Resource flows, increased funding for mentorship programs, extracurricular activities. So these are ways to change the aspects of structural change conditions. On the next slide, we're going to go to that middle tier. Again, the challenge, BIPOC students don't graduate high school, college, and career ready. And the relationships piece of it here, you have there's just a lack of college and career advisors. I think the data is like 1 counselor for every 900 Arizona high school student. Abysmal, right? Those are relationships that don't exist because of that number. There are fewer connections with potential employers, making high school internships rare. Another great example, especially in the healthcare workforce space, thankfully our universities are implementing new colleges of medicines to incorporate and address our healthcare workforce shortage. I know community colleges and the area health education centers, or AHECs, are doing great work in this. Power dynamics are changing. Those closest to the problem aren't closest to the solution. Students and families often are kept out of those rooms. So here are some solutions on the next slide. The ambitions: create more cooperative education programs. I mentioned that here as an example: universities, community colleges, AHECs. And then power dynamics. We're in an election year, right? Let your voice be heard. Parents, teachers, those closer to decision-making bodies. So that's the middle tier. On the next slide, the same challenge, but tackling at the mental model change. BIPOC students and their families feel unable to afford higher education. That's a really big issue. They don't feel represented. Teachers often have negative mental models about BIPOC students, right? So that's the challenge. A mental model solution on the next slide, the ambition there is to increase awareness of financial aid, mandate implicit bias training. So that would be a mental model solution to tackle that challenge in our overall ambition that students graduate high school, college, and career ready. So that's a case study using the educational system. On the next slide, Vitalist has undergone this series, system change series, to better define what system change is. But we also have to identify what system change is not. So if you click on one more, the right column begins to address this. So I mentioned some of the characteristics of systems change: collaborative, unified efforts, focus on root causes, inclusion of impacted communities, holding a health equity lens, shared leadership with the decentralized model. It's non-linear, it's a bowl of spaghetti. So this is continuous improvement and learning in an ever-changing environment. On the right-hand column, this is what systems change does not include, right? The symptoms of the challenges would be this kind of reflection of the downstream, upstream intervention pieces of it. Addressing the symptoms of social changes often are those downstream direct service programmatic interventions rather than the upstream systems. Delivery programs through a single organization, even though we know they're in a larger ecosystem. I often give the example of food banking because I used to work at St. Mary's Food Bank Alliance, right? Food banks would be addressing the symptom of social challenge of hunger and food insecurity in our communities. Food banks do really, really important work with distributing food boxes for those that are hungry today. But why are they hungry in the first place? Why are they going to the food bank? Why do food banks exist in the first place? That would be tackling the systems change. And then systems change is hard to evaluate, as I'm sure you know. And we don't just measure the outputs, right? Like in a food bank world, we're measuring kind of the amount of food boxes that are going out. That would be a programmatic output rather than a system change approach. So let's test the room here, okay? So on the next slide, a little pop quiz. System change or program change? Raise your hand. The first example, a coalition collaborates to design and execute an awareness campaign to destigmatize depression for adolescents. Hands up if you think is a systems change. All right. Hands up if you think a program change. Hands up if you just don't care. Or hands up if you're not sure, or maybe both. Okay, we're kind of split here. So let's break this down. So a coalition collaborates. That should be your first clue that it's systems change, right? Design and execute an awareness campaign. Awareness campaign to change hearts and minds, right? The mental model piece, especially to destigmatize. That's a stigma, that's a mental model of belief. So again, one of the conditions of systems change. So this one would be systems change. The next one, a city partners with a mobile home provider to offer temporary low barrier shelter for unhoused individuals. Systems change, raise your hand. Program, raise your hand. Gold sticker for everybody. Yes, program. The city in this case is partnering with mobile home providers. That's good, right? But this is a programmatic direct service, a more downstream intervention. Why are people unhoused in the first place? That would be the systems change. The final one, prenatal service providers implement a one-stop shop referral system to better coordinate services and support for pregnant mothers. Systems change, raise your hand. Program. Don't know, maybe a mix of both. This is a really interesting one, and one that Anna and I see a lot. This actually would be a systems change, okay? And some people do see it as programmatic because it's sort of like the referral, right, is a programmatic concept. In this instance, it's sort of like the coordinated system of care. And that kind of makes it a bit more, there's gotta be collaboration for this referral system, more than one organization. Again, this is, we see this happening now with Access and the closed loop referral system, right? That would be, we're working really hard on that because that's a systems change. How transformation would that be? So cool. That was a close one, but that is systems change. Next slide is some common pitfalls that we see with systems change, and you could just click through, click. 2 more. All right. Rewind. Okay. So these slides are available on the Whova app and whatnot, so we can follow up on this later. But as per usual, I'm Chatty Cathy, so I'm running short on time. But the one thing I do want to hit is the second one. Okay. Common pitfall. Don't demonize the top row. Some of us love policy and practice. Okay. Respect our game. Don't yuck our yum. Right, Matt? And sometimes you have to go down to the state capitol to make systems change, or to the city hall. And it's a condition of systems change. Not always, but to reach a transformative systems change that is going after the root cause, you have to sometimes do that. And then another big one is don't demonize programmatic work. Even though we do want more organizations working towards systems change, in the food bank example, people are going hungry today, right? We need to give them food boxes today. Food banks need to exist, right? So while they're doing that, let's also look at the root cause and the systems change so that maybe one day food banks don't have to exist, right? So we don't demonize programmatic work. We have to do both. So a couple of things to reflect on when you're thinking about understanding and identifying systems change, kind of going back to that case study. Define your ambitions, jot down a social problem, challenge your work aims to address, diagnose the problem, looking at the 6 conditions of systems change, thinking about the factors that are holding that problem in place, and then explore the different strategies. This is the fun part, right? Where you're thinking, okay, how can we kind of think of ambitions in each of those 6 conditions? On the next slide, a super fancy activity worksheet. You can use this. Think about the 6 conditions along the left, and then answer those 2 questions in the different columns. So just some final reflection on kind of systems change. What's going on in the system that you seek to shift? What systemic conditions might be holding these problems in place? Right, pretty hard conversations that we have to get. who is that decision maker that's like, oh, if only they lifted their thumb, right? Life would be so much better. Who is connected in your system? This is also a fun part, because this is what brings us into this space, right? There's so many great organizations that are doing phenomenal things across Arizona. How do we strengthen those relationships? Who are you collaborating with? And how do we get on the same page with this work? On the next slide, and again, we'll share this out, are a bunch of resources that both Vitalis and FSG puts out. The first link there, Understanding Systems Change, is that Spark report or the white paper that we put out. And if you get out your phones, on the next slide, you can scan some of the QR codes. These are deeper reads that FSG put out. The Waters of Systems Change is a document that really covers the 6 conditions, cool toolkits, and then that collective impact forum, as I mentioned, is a collaboration between Aspen Institute and FSG. Finally, just a commercial for Vitalis. So yay, that's a system change. Now we need money to go do it, right? And Anna and I are in such an awesome position to support opportunities through our Systems Change Grants program. We have 3 different types of grants: technical assistance, Spark, and systems change, that we are happy to explore and discover partnership with you. So on the next slide, we follow what we call a discovery intake form to discover partnership. If you go to vitalishouse.org, you can learn more about the 3 grant types we have and complete a quick intake form. We call it the discovery form. And then you'll be scheduled to chat with a Vitalis team member to explore, on the next slide, the more specific grant opportunities we have. So the technical assistance grants are meant for coalition capacity building, because systems change work takes a village, and we want that coalition to be strong and ready to then plan for their systems change and have the idea sparked, which is the Spark grant. So meant for those coalitions that are formed, they just need a year's worth of time to plan towards their systems change. And then from there, hopefully be in a better position to implement their systems change, which is a multi-year funding available through the systems change grant. I especially want to highlight that because the submission deadline is November 15th. If you go to vitalishealth.org, you can find more information about that specific criteria and the process. Watch this virtual information session, and then it's an open application. So anybody can submit the application to that. And that's systems change. Thank you all so much. Okay.
Thank you. Thank you so much, David, for your insightful presentation. Now, as we begin to wrap up, I'd like to open the floor for a Q&A session where we can explore some of the ideas that you have shared more in depth. So, any questions? Yes. How do you stay grounded and anchored? Give me one moment. I'm going to have you. Oh, there is. Thank you.
Hi. Oh, okay.
Can you say your name?
Hi, I'm Amelia.
Okay, hi, Amelia.
I have a question for you. So how do you stay grounded and keep clarity in a whole bowl of spaghetti in a non-linear role?
Yeah. Oh, goodness. Let's see. I'm trying to go through like some of the examples we've had to provide you like a real life case. One, we recognize change happens within systems change, right? It is non-linear. It is a bowl of spaghetti. At the same time, you keep your eye on the big prize, but celebrate the small successes. This is the continuous learning and improvement piece. And we have found in some of our system change grant partners, they, when we did the 10-year look back, they're just like, oh man, we were shooting for the moon. And we realized, you know, we weren't even leaving the earth, let alone like landing in the stars. And we're like, that's okay. Okay. So let's track your progress. Like what successes can you count on? So for instance, there might be like, we just wanted to set the table. So we were astounded that like 50 people came to our first convening to begin to talk about addressing the system. That's a victory. So I think counting those like small successes can help keep you kind of focused and joyful in the work while still trying to address the big piece of it. oftentimes collective impact work, it's beneficial if you have a strong backbone organization or a facilitator. So in our technical assistance grants, and even in all three types of our grants, we don't have like a prohibition on administrative or indirect costs because it's heavy work, it's heavy people power. So there's a lot of human resources, including hiring a neutral facilitator to hold space so that the individual partners representing their individual entities can still like go back to their work site and do their important, maybe programmatic work, but then this neutral facilitator can hold the space for the collective action. So that's another example where I think people have tried to keep kind of grounded and focus in this work. I feel like there was a second piece of that question, and I'm seeing or is that a protester? No, it's just like, okay, no worries. I'll be around, and Anna and I are very accessible to answer any more specific questions about your work. Thank you so much.
Thank you, David, for sharing your expertise with us today. And we'll take a short break. Please join us again at 2:20 for our next session. And before you head out, I want to remind everyone to participate on the Whova event app. We're hosting a leaderboard contest and a photo contest, so be sure to get involved. And for those of us that are here in person, don't forget to stop by our raffle table for a chance to win one of our amazing prizes. Enjoy your break, and we'll see you back here at 2:20.